And it's Tuesday, as usual. Joining us now is In Focus Health correspondent Linord Moudou with a story about healthcare in the Congo. Linord?
Yes, today it's all about traditional medicine. And during the 1990s civil war in the Republic of Congo, the war destroyed much of the country's infrastructure. So with few doctors to serve them, many people turned to traditional healers, even for serious injuries. 14-year-old Juvelia Bongo suffered a serious foot injury in an auto accident. She still limps, but she says she is able to walk because of the treatment she received at a private clinic.
Some soldiers took us to the hospital, but my injuries were too severe. For 3 days, I didn't receive proper treatment, so they wanted to take us to Pointe Noire, but my parents preferred to bring me here, to Mama Bertholine.
Bertholine Malombe is Mama Bertholine. She treats bone injuries at an improvised private clinic, mixing traditional healing techniques with modern methods. Mama Bertholine first disinfects wounds with Western medications, then treats them with Asian massaging techniques and herbal remedies. She also uses modern techniques she says she learned while training at a conventional hospital. Modern medical doctors are among those who doubt traditional healing methods. Dr. Sonny Benga says traditional healers are not able to give adequate care, and patients often end up using modern medicine.
There's a number of patients that have been there, but eventually end up in the government hospitals looking for conventional orthopedic therapy.
But many people in Congo and other parts of Africa have no other choice. The World Health Organization says there are only 2 registered physicians for every 10,000 people in Congo and estimates that 80% of the population resorts to traditional medicine. Linord Moudou, VOA News. Well, joining us for more on this topic is calling from Pretoria is Professor Kensese Mossanda. He's the Executive Director of Prometra South Africa. Welcome, Professor.
Thank you. Welcome.
We know that traditional medicine is an ancient practice in Africa and many parts of the world. Tell us about the case in South Africa as of today, how popular it is.
Yeah, in South Africa, I think the government did a good effort, a big effort to put together the traditional healers. There are many associations of traditional healers. It depends where each province. They've got more than, I can say, 20 associations of traditional healers. But the government tried to put them together so that they can really contributing in the healthcare system.
And why do you think that traditional medicine is so popular in Africa specifically? Would you say it's about accessibility, cost, or just the fact that it's part of the culture in general?
Traditional medicine is really, let's say, popular here in South Africa. That's because, as you know, we have in Africa in general, 85% of African population are seeking for advice, care, and treatment from traditional health practitioners. Here we call them, we don't call them like let's say, Western country, they call them, in French, they call them guérisseurs, but here we call them traditional health practitioners because they don't like to be called doctors, or they don't like to be called, let's say, like some of the words that they don't like. So what I'm saying that most of the majority of African population are seeking advice and care from them.
Indeed. And now tell us about this issue. There have been many concerns raised by some experts, some health experts, and in the media as well, talking about the limitations of this practice. There have been a case of President Yahya Jammeh of Gambia who said that he had found the cure for HIV/AIDS, and later on, some people claim that this was not true. Tell us about how this can impact the validity of traditional medicine.
Yeah, the problem here is because many of the traditional healers are not really educated. and then they don't have a kind of treatment for virus. They have a treatment for opportunistic infections against, let's say, diarrhea, things like that, but they don't have really a cure for HIV. But because it's a problem, HIV, people they just try to say that they've got. But now in South Africa, many traditional healers, they know that they don't have a cure for that. And they don't pretend that they've got the cure for that.
So how do you address the issue when someone who has HIV comes and seek your help?
Normally, people having HIV before the introduction of the antiretroviral, they used to go to the traditional healer who try to, let's say, treat the opportunistic infection, not really the virus per se. So now, because we are trying to educate the traditional healer here in South Africa to know exactly what are the symptoms of HIV, for instance, the symptoms of many some of the disease. They are learning. They are really prone to learn now more about HIV in a scientific way. It was not easy to make them understand exactly that they have to work with us. They have to work with scientists. They have to understand what's going on one disease.
So very quickly, 10 seconds, do you think there should be a partnership then between traditional and modern medicine in addressing the issue of HIV?
Yes. Now in KwaZulu-Natal, in the region south of Africa, South Africa, they've got a big issue there. The University of KwaZulu-Natal is trying now to put together the traditional healer over there.
Okay.
Together. They're having training, and then now they understand that they have to work.
Great.
Yeah.
Unfortunately, that's all the time we have. Thank you so much for joining us, Professor Mossanda.
Okay.
All right, and that was
Yeah, that's
the topic
great.
today.
It's good to know that there is and there are alternatives. Yeah. So, for more information on this stories, go to voanews.com.